I'd like to thank our course directors here for the invitation to present. So I was privileged yesterday to be part of the Scars and Striae session, and so what I wanted to focus on today was to really just focus only on laser usage in my practice. Dr. Holtman had a very nice complimentary presentation with how he incorporated both traditional surgical and laser techniques, and I included some of those of my own cases yesterday, so I don't want to repeat that. I'm coming to you from Shriners Children's now in Boston, which it's called. It used to be called the Shriners Hospitals for Children. They just recently rebranded the name. And then certainly the main reason I'm here is because of Dr. Dueling here, who was my mentor back when I was a resident and has been my mentor obviously since my return back to Boston, and it's been really amazing learning all of the new things that I did not see when I was a resident, and how much things changed in about the 5-year break from my time coming back and forth between Boston, Baltimore, and back to Boston. So the reason I show the picture of the Shriners is because all of these cases are actually from that institution. I'm also on staff and I have a very busy practice at Mass General Hospital. But if we look at just pediatric scars in general, specifically the kinds of cases that I'm going to focus on, you know, the two enemies are hypertrophy and contracture, and as has already been stated very nicely by Dr. Holtman, those are many of the reasons we do what we do and the motivations behind that. Now, I was anticipating that Dr. Dueling was going to include a case that I got his permission previously to show. This has been well published, and I think that one of the things that I like to do is to take the knowledge that I've been able to obtain and build a fundamental base, and then build on that so that at least my base is always going to be fundamentally sound. And when I look at this case in particular, and he already showed this in some detail, when you look at just tension releases, and then in addition, as you have an armamentarium of a pulse dye laser, a fractional blade of CO2 laser, or whatever energy or light-based device that you have at your disposal, you can really make a very, very good case that in a very predictable fashion, you can get these types of results. And I would say that in my opinion, it's very hard to argue with that. He's made an excellent case in terms of his presentation. Dr. Holtman is supplemented that, and what I hope to do is just to sort of show what you can even do with some of these just by using laser-based options alone. So when I got back into practice in Boston, I started seeing the types of cases that I saw as a resident, and then some. And it was very difficult for me to sort of get comfortable because I hadn't really used the pulse dye laser since I was in training in 2008, and I got back into practice in late 2015. So I really didn't start treating patients until early 2016. So I had a lot of room in terms of making up that time where I hadn't used the pulse dye laser, but I was certainly familiar with it, and then also trying to understand this fractional blade of CO2 technology, which I had no exposure to whatsoever. It was instituted, I believe, around 2010-11 in Boston. And so the way I sort of thought about this, and having excellent mentorship, particularly from Dr. Dueling, Dr. Anderson, Rox Anderson, has really been available to me and has given me a lot of insight in how to be careful and thoughtful. I was presented with this very unique capillary malformation of the sort of the vermilion going all the way up into the base of the nose at the alar base. It's a very unique lesion. And so as I just started my practice, I basically attacked some of these cases that were essentially very straightforward, but needed a certain learning curve. And so what was interesting in this case was that the patient that day came in, and mom said, well, our family dog had a little sort of scratching of the cheek here, and we're worried about scarring. I said, well, don't worry about it. If it's okay with you, I'll treat this 4 or 5 day old scratch, and I'll treat the capillary malformation at the same time, and that's what I did. Very straightforward pulse dye treatment with an appropriate endpoint in terms of purpuric response, both at the main location as well as this area. And then, what was nice is I was able to do 3 treatments, which is probably what would be very reasonable for a lesion of this size and intensity. And then the patient's mother actually put together a collage of the progress in terms of how her child was doing over time. And these were delayed pictures after every treatment until eventually she was able to, send me a picture where you can almost see the entire area is gone. They've been extremely happy, and we've left it at 3 treatments at this point in time, and I just see the patient annually. Now, in terms of how do I incorporate sort of building, the blocks up to a level of being able to attack more difficult cases, after I had some experience under my belt, both doing the pulse dye as well as a fractional blade of CO2 laser, then I came across this patient. And certainly there was a lot of discussion. They had had multiple visits with other providers. They had been offered excision of this. They had been offered excision and grafting of this. They had been offered Z-plasty of this. And, my opinion, after having, at this point in time, had enough time under my belt to get comfortable, was that I thought a laser-based option only would be ideal for this situation. And so this is a challenging case because of the patient's skin type and color, and then the concerns about inducing pigmentary problems. But I basically approach this very methodically and carefully. This is an intraoperative photo. You can sort of see before, immediately after treatment at a very reasonable setting. This is 30 millijoules at 10% density, just showing on a popsicle stick a little bit of the differences by even a 2.5 millijoule difference. And what I was able to do ultimately was to get her to a situation like this. And what I learned from treating this patient, as well as how stigmatized I think her parents were, they were devastated by this injury. But slowly but surely, they were very, very happy with the slow but sure outcome that we were able to obtain in her. And I think what this case specifically shows is, if you just sort of look at her from start to, sort of midpoint, and then in the center here, the completion, at this point in time, they were so pleased they didn't want to really proceed forward with any further treatment. And so to summarize this case, what I wanted to sort of show is that these were the number of OR sessions for this approximately 8 by 2 centimeter scar burden that I had treated over about 3 years. And I basically exclusively treated this with a combination of settings using our fractional blade of CO2 laser and nothing else. I would argue that, based on the cases that have been shown by Dr. Donnellan and Dr. Hultman in particular already, that is a very reasonable way to proceed. We haven't stigmatized, caused any donor site issues, and caused any other problems. So to finish up, basically the way that I put this all together was, these are another very interesting example of how I could now combine those modalities, both in pulse dye as well as fractional blade of CO2 laser. This was a brother and sister that were unfortunately attacked by a dog while they were in their mother's car as she was unloading groceries. And so these are their presenting photos to me after about 3 months of their injury. And this is just to sort of show you time lapse using both pulse dye as well as fractional blade of CO2 laser, 10 treatments over 6 years. This is her most recent picture from last month. Again, sort of showing the proof of concept. And then similarly, if you get a little closer view, you can see again the very favorable response. And this is her brother. He had a little bit more serious injury. On the left side, he actually requires some facial nerve reconstruction, and he was much more seriously injured. But similarly, I used the same combination of multimodal laser, pulse dye, and fractional blade of CO2 in this patient. And you can see his outcome. Similarly, he required 2 extra treatments compared with his sister over that 6-year period. And these are their follow-ups. I literally see them at the same time together. And again, you can appreciate what we've been able to achieve in the outcomes. So that being said, I think, as Dr. Donnellan, as well as Dr. Hultman and many others have shown, I think these important observations really are very, very reasonable, and I adhere to this. Thank you for your attention.